Hello everyone, my name is Dr. Afifa Zareen and I'm one of the pediatricians at Care Hospital, Banjara Hills. So today I'm going to discuss with all of you, all the parents, a very common topic and every child goes through this like almost very frequently, once or twice a year. So today I'm here to discuss about fever in children and when you should approach a pediatrician. So what is the definition of fever in children? So to avoid a lot of specificity, I'll give you a general idea. So fever is something when a child has a temperature of more than 38 degrees centigrade or in Fahrenheit 100.4 degrees Fahrenheit, temperature is defined as fever. So if your child is running a fever, then this is the definition for fever. Now, what is a high grade fever and what is a low grade fever? Many times we hear people talking that, oh, my child is having very high grade fever, oh, my child is having a low grade fever. So what is high grade and low grade fever? Low grade fever is if your child's temperature is somewhere around 100 to 102, and high grade fever is if your child's temperature is around anything around 102 to 104, that is termed as high grade fever. So as pediatricians, for us the most important part regarding fever is that parents become really apprehensive whenever a child has a fever spike. So we need to understand that fever is a protective mechanism. So the child's body is trying to destroy the virus or bacteria or whatever infection he is having by increasing his body's temperature and metabolic rate. So actually fever is a protective mechanism. So the parental anxiety related to fever needs to come down because it is a defensive mechanism rather than a dangerous mechanism. But at the same time, it's very important to control fever, especially in children, because there is an entity called as febrile seizures, which happens when a child has a very high grade fever. So what high grade fever I'm telling? As we know definition, 102 to 104. So the probability of throwing fits in fever is very high when a child's temperature is this much. So you need to give paracetamol, hydrate your child well to avoid this fits during fever. And also see a local pediatrician if your child is already having a single episode of febrile seizures in the past to get seizure prophylaxis, of course. Then after that, what are the indications and what are the warnings or what are the data which you need to know when to see a pediatrician when your child is having a fever. So when do you go to a pediatrician when your child is having a fever? So if your child is having fever which is more than 72 hours and it's not subsiding, not responding to antipyretics like paracetamol, oral hydration, then you need to see a pediatrician. The second thing is that if your child is having profuse vomiting and diarrhea. What do you mean by profuse vomiting and diarrhea? Profuse vomiting and diarrhea causes like lethargy in your child. When your child is not passing urine properly, you can feel that the child's head is very soft or the child is very irritable or dull. Then in that situation, you need to see a pediatrician. Another thing is that if your child is having breathlessness, you can clearly see that your child is having difficulty in breathing, or you can see if he's pale or blue, or if he's dull or lethargic or irritable, then you need to see a pediatrician. Another thing is that when your child develops a rash with fever. So rash with fever, definitely you need to see a local doctor because you need to find out whether the rash is viral in origin, bacterial in origin, whether you need to have a conservative management or you need to start any drug for it. Another thing is that if your child is having anything like seizures, that is fits, if the child is complaining of severe headache, or if the child's behavioral pattern is changed along with fever, then you have to see a local pediatrician. It's very important. If your child complains of burning while passing urine, or not at all passing urine very frequently, then again that is a sign of urinary infection, and in that situation you have to see a pediatrician. Any child who is less than 36 months, irrespective of these symptoms, develops fever has to be seen by a local doctor. Even though if he doesn't have any warning signs, develops only fever, still has to be seen by a local doctor. It's very important. So these are some of the guidelines associated with fever. I hope you can understand all of them and your apprehension. I do understand the parents are very apprehensive regarding fever, but we still need to remember it is a protective mechanism and absolutely we can control it. So I hope you enjoyed the topic today. Thank you.